So hi everyone, I am Vivian and I'm gonna share with you a home guide against COVID-19. I actually made these slides for my family member pero I'm gonna share it to the rest of the world na makaintindi sang akong lingwahe. So by the way, I'm practicing doctor overseas in Singapore, but in Asia, my source of this talk is from WHO and Department of Health, no? Sang Pilipinas. Okay. So tip number 1, kung naay pasyente nga identified nga para lang siya sa homestay, no? Homestay patient. So place the patient in a well-ventilated space. Single room, isa lang siya dito anay para hindi na magkatag ang kagaw, no? And usually may recommended nga home isolation is 10 to 14 days. So 14 days pa sa WHO recommended but case to case basis. So ang start of treatment o start of sa symptoms nimo bilang kadira kag kung mild lang gid siya okay lang. So home setup 14 days isolation. So make sure that the room is well ventilated. Tapos, example, limit ang movement ng pasyente inside the house na minimal shared spaces. Example, dito lang siya, na isa to sa lugar niya kung diin siya Um, in the hospital setup, ginabutangan gani namon mga harang para hindi maglinapta. Like for example, ikaw anay, dira ka lang niya imong lugar. So your banyo, your kitchen, your banyo, as much as possible, siya lang to gamit. Okay? And always keep the windows open. So this will be fast. Tip number 3, household members should stay in a different room. So kung may ara man lang kamo room nga lain, please utilize it, no? So isa-isa lang gid anay para di ka maglapta. Kung hindi na gid maanuhan kang inyo nga balay, amo lang gid sini. So stay at least 1 meter apart from the ill person. So hindi pa gid kamo magtulog in a same bed, no? Kay ay naku malumpat gid si COVID sa inyo. Okay? So at least 1 meter from the ill person. So tip number 4, so, like for example, may nagsakit siya. So, ang identify hindi, i-identify lang is limit the number of caregivers. So, ideally, assign ka sang someone nga mag-atiman. Example na kay lola or auntie or tigulang nga nagpositive, no, nga naibalatian. Assign someone nga healthy, is in good health, walay chronic condition sa pasabsin, wala sa high blood, walay diabetes, walay asthma, walay COPD, walay kidney disease, walay cancer man sila, or not immunocompromised. So amo na siyang ang ideally nga magbantay, so siya ang mag-run sang errand. So pero ang pasyente ara anto nagyapon sa iyang room tapos kaupod niya, but always limit hindi pagpasudlan sa mga bisita until nga magka-recover ang pasyente and there's no signs of COVID-19, na wala sang symptoms and COVID-19. So I think by now, after so many long years of COVID, pila na siya ka tuig, no, kag binulan sang COVID-19, you know already what are the signs and symptoms, expert na mo. Okay? So tip number 5, always perform hand hygiene after each contact of the patient. So example, nagserbi kasi sa pagkaon, nahatag siya. So always wash your hands. You should perform it before ka magkato siya and after, especially and after you prepare food or before magkaon or after using the toilet. So if your hands look dirty, may higko dira, you should use soap and water. Kung matinlo na siya, you can use alcohol-based hand rub, no, sa mga alcohol gel. And when washing with hands and soap and water, preferably, no, i-dry mo imo kamot. Kung may disposable paper towel, let it dry. If wala may paper towel, use a clean cloth but replace them frequently. Hindi pagpabutas ang sinimana ang inyo nga trapo dira. Gamita ang labhan siya permi. Okay? So, tip number 5. So, like example, syempre may ubo na sila. To contain the respiratory secretions, no, provide them a medical mask, no, sa pasyente and must change daily. Okay? So, sometimes ang pasyente sa bata hindi siya ka-tolerate sa medical mask or mga tigulang hindi ka-tolerate sa medical mask. So, puwede mo man nga example kung mag-ubo siya kaweran sang tissue paper kung with cough and sneezing para hindi na maglapta ang kaka. Okay? So materials used to cover mouth and nose should be disregarded after use. Like for example, or clean or iwash siya after use. So example, handkerchief dira. So kinahanglan labhan siya sang sabon kag detergent, no? So sang detergent tubig. Okay. So tip number 7. So ang gabantay, always wear a medical mask that cover your mouth and nose when in the same room as the patient. Pagtapos hindi na pagtanduga ang mask, do not touch or handle ang mask. Hindi na, mask should not be touched or handled during use. So hindi mo siya sigig tanduga. Remove the mask using the appropriate technique. So usually, do not touch ang sa atubangan na bala example. If you have a mask like this, di sa dire, but you have to, kay usually may ano ni siya mo, mo sino. So sa likod siya kaon kag pero ang common nga mask what you have is the wala ko dire sample. No, kwaon yung sa diri, anti the mask, okay? And then sa inyong ears, and discard them appropriately, discard them immediately, and perform hand hygiene, okay? So how to wear your mask properly, okay? So these are the correct techniques. So always remind inyo ang mga upod sa balay pag ara na gani may makita ka mong balo nyo kay uho na ang ilang mask, no? Hindi pakipagwa ilang ilong. Tapos ang diri man always to cover gidiri ang sa ibabaw may di ba may metal na siya inyo na dira i-press gamay no ito para mag-contour sa shape sa iyo inyong nose. Okay, so tip number 8, avoid direct contact with body fluids, particularly oral and respiratory secretions and stool. So syempre kung ato ka mga tigulang, use disposable gloves. Tapos, kung mag-dispose ka mo sa mga tai or kung magtandog ka mo sa ilaha, on mask also when you are when you are taking care of them. And perform hand hygiene after you remove the gloves and after you remove the mask. So, importante gid ang pagpani. Okay, so tip number 9, do not reuse masks or glove. So, of course, sometimes ang gatipid pagid. So, gatipid, no? So, ang mask, common, ginisang initial parts ng pandemya. Ang mask kay nagmalahalan tanan. So, ang ginabuhat is, may iba may galaba paguro. Ang iba niya, UV light lang kuno. But, of course, we're not sure how effective is your UV light. So, as much as possible, do not reuse mask. Likewise, sa mga gloves, ihaboy na. Nakita pa ko natandaan ko sa una kaga-recycle lang, hindi ko gintrabaho. Na-recycle pa sa mga tao ang gloves but if you're touching, okay na kung nagahilamon gamiton, pero kung ginatandog mo ang sang secretion sang tao, sang pasyente, tandog ka sang tai, nag-rectal exam ka na. So, please dispose it properly. Okay? So, then tip number 10, use dedicated linen and eating utensils for the patient. So, siya lang ang iya na yung mga gamit, siya lang gidya ang gamiton ang hindi pag-i-share with the rest of the family members. And it should be clean with soap and water or wash after each use. Of course, ang mga kutsara, pinggan, tinidor, they can be reused, no? They can be reused, hugasan mo lang sang insakto. Okay? So next is tip number 11. So daily clean and disinfect surfaces that are frequently touched in the room when the patient and being cared for where the patient is being cared for. So like examples, mga bedside tables, bed frames, and other bedroom furniture. And the cleaning solution, disinfectant solution is use your 0.1% sodium hypochlorite sa pag-disinfect. And you have to disinfect also your bathroom, toilet surfaces at least once daily. Okay? Okay, so this is just an example of preparing guidelines of mixing bleach solution for ginagamit sa childcare. But of course, you can use this sa inyong mga balay. Okay? So, for example, ang bleach strength mo, kadamo sa, kung hindi mo ni magets, you can screenshot this or you can Google also paano mag-mix ang solution. So, make sure tanawa ang bleach strength nimo. So, for example, ang common sa aton this is 5.25 to 8.25. So, ang sunrox tanawa nyo. Like for example, kung gamiton mo siya as disinfectant sa imong mga gamit sa balay, no? Yung mga toilet seat, toilet bowl, o sa isa ka galon, butang isang tatlo ka kutsara, kung ang bleach strength nimo is 5.25 to 6.25. No? Duha kutsara kung 8.25 siya. To be used as disinfecting solution. Kung sanitizing solution, iba naman ang pag-prepare, so lesser. So, you clean the surface with soap and water before disinfecting or sanitizing. So, sabunan anay, tapos applyan sini. And then, rinse with clean water and dry with paper towel. So, and then you apply your chlorine bleach and the water solution to the entire area to be disinfected and sanitized. And let it air dry for at least 2 minutes. Okay? So tip number 12, always clean the patient. Use clean patient's clothing, bed linen, and bath and hand towels. No, you have to wash it regularly with soap and water. Using your common household detergent and dry thoroughly. And then ang linen na contaminated, usually kay wala mo gamay mo lang sa aton ga washing machine, gagamit sang laundry bag, but do not shake soiled laundry so that hindi na siya mag-contaminate sa imong nga panty kag sa iban nga mga clothes. So do not shake. So okay, so this should be like tip number 13. So gloves and protective clothing. So pwede ka kagamit sa plastic apron. So when cleaning the surfaces, especially if you're handling body fluids, no? And then ang inyong single-use gloves, so kung ihaboy na siya after each use, no? And then kung ang inyong gloves na hindi siya disposable, you have to clean it with soap and water. Okay? But the single glove, example to mga latex glove, should be discarded after each use. And perform hand hygiene before putting on and removing gloves. Okay? So next, gloves, masks, and other waste generated during home care should be placed in waste bin with the lid in the patient's room before disposing as an infectious waste. Do wala man sang classification gid sa aton nga if as much as possible kung may segregation ang paghaboy sa mga tae. So naka-diaper no aboy sang tae ihi naka-separate compare sa mga kitchen nga mga waste, no? So you have to wear your gloves and wrap it carefully with towel, no? And before you put it in your disposable bag or disposable bin na may cover. Okay? So avoid other types of exposure to the contaminated items from patient's home environment. Of course, siguro, wala man gid sa ato may nag-share sang toothbrush, may ara ang mga sigarillos, hit sa pihak, hit do gamito man sang isa. Please avoid this during pandemic. Ang mga utensils hindi pag-share matilaw sa pihak hinatag mo sang pihak to. Hay. Your dishes, drinks, no? Kay nagtipid o isa lang ka drinks ang orderon, kindly minimize it. Okay? So, this is to avoid contamination. And of course, may mga sakit nga pwede makatag, no, with share. Okay, so down to my last slide is after mo na nagpaninlo sa inyong balay, kanus ka pwede ma-release sa may isolation room. So anyway, the WHO recommends that example positive ka sa COVID swab, no? As positive ka sa 2 weeks after your symptoms resolve. So like for example, wala ka na ubo, sipon, subong adlaw, wala ka na fever for whole 24 hours. 2 weeks after your symptoms resolve, you can de-isolate yourself. And also, from the monitoring facility sa hospital, may release ka nila. But of course, different ang sa hospital setup kay hindi ka sarang ang aton hospital to keep you for 2 weeks. So they have a different protocol. For example, okay ka na, ibutang ka na sa facility lang, na ano sa ibang nga facility, instead of staying in the hospital kay because there are other patients nga kinanglan sang room nga which are toxic, ano? Kinanglan sang immediate attention. Okay? So this is the last slide. So thank you very much for your kind attention. I'm gonna prepare some more slides about home care treatment, what you can do. So please follow and subscribe to my channel. Thank you very much.